Well, we have a couple COVID updates for you. First, the state of California is notorious for having some of the strictest COVID-related restrictions, but this week the city of Beverly Hills voted not to enforce LA County's mask mandate. And that decision comes as the county has seen an uptick in COVID-19 cases. So I'm happy to see democracy at work. The people, through their elected representatives or their appointed representatives, whoever runs Beverly Hills, said no more to this mask tyranny, Briahna. No more. We've had enough.
They're allowed to do it. I don't know what to tell you. Individuals can continue to keep masking. I hope that folks who are at particular risk, which are a substantial part of our community, a substantial number of Americans have either some comorbidity, whether it's diabetes or being overweight or asthma or these things that are very, very common. And I hope people focus more on the efficacy of high quality masks, and that is really the last line of defense that people like that have against infection from community members.
But all it can be is a recommendation for people to, if they feel like wearing it.
I'm making that recommendation. There's no mandates happening
I
here.
know. But what I'm saying is even the mandates that do go into effect, right, they never require the masks that we understand are perhaps making some kind of difference, which is
taking a moment to re-emphasize that the higher quality masks really do work and that people who have concerns can avail themselves of them. Yeah. Meanwhile, in Wuhan, China, they have a different approach, obviously, to dealing with COVID. 1 million residents in the city were put on lockdown as cases of COVID-19 there are on the increase. The city came to a grinding halt after 4 asymptomatic cases were found in the district.
I mean, it's
fascinating to me that they have such good contact tracing and testing going on that they were able to identify just 4 asymptomatic cases in the city and then respond. I think that most folks here are not especially receptive to an approach that's quite as strict as what's being done in China, but results, and I know some people quibble with the accuracy of the numbers, the results are that they have had exponentially fewer COVID deaths than we have. And it would be interesting to see if we could finally, 2 years into this, implement some of the tracing policies that help manage the pandemic, even if people are less sympathetic to the behavioral interventions that they've implemented in Wuhan.
Which are extreme. People, shut up in their homes, people not leaving, the drones broadcasting messages to control your soul's desire for freedom. I mean, it's a pretty dystopian kind of things.
Why do you think there hasn't been more advocacy for some of the other things that don't require constraining human behavior, like getting better ventilation systems in schools and public places, like doing more tracing and genetic testing to see, we're talking about this in the context of monkeypox. I was reading that in West Africa, where they've been dealing with it for a while. They do a lot of genetic tracing to see what to trace which infection came from which place and how the virus is moving around the different localities.
I mean, isn't this just our government officials, our health bureaucracy not prioritizing the right things? I mean, there was never a concerted effort to prioritize test and trace.
Yeah.
They simply did not go with that option. In fact, they screwed up testing royally and then never looked back.
It's also interesting to me that there's not a lot of arguing the alternative. Like, if I'm making the case for, let's say, universal health care, I expect most folks would say, well, here's the critique of it, and I think that this solution is better. You saw this a lot during the Democratic primary, folks who want health, Medicare for all who want it, and all these kinds of variations on a theme to try to fill in the void. But if I were someone who was very, very frustrated with mask mandates and things like that, like so many people in the country were, I would have expected a more robust political argument for some of these kinds of interventions. And I've seen few people calling for it in a way that I think is ultimately
I was very supportive of testing and funding for testing, absolutely, because testing is not invasive.
Sure, if you were advocating for it, then that's great. But the argument I'm making here is that when you don't argue in the alternative, it basically sets you up for the government thinking that if they only have a hammer, everything looks like a nail. And there's not a more robust public conversations about the kinds of things that you could do that don't require keeping people in their homes or forcing people to wear masks or
but they're doing it, and they're doing it again right now. If you hear stories, we read some accounts of people who've contracted monkeypox. It sounds horrible. And then their difficulties of even communicating to health officials that I have monkeypox, I need help. And also here are the contacts I've had. Are you going to do any follow-up and talk to those people, and no, they don't even take their full information. They're screwing it up right now.
That's what happens when, I'm sorry, so many people don't have primary care physicians, because so many people go through long stretches in their life where they don't have insurance. People who contract monkeypox, I recently learned you have to quarantine for about 21 days, I believe, which is hellish if you have any kind of job in all of these right to work states where they can fire you for any reason.
I mean, a lot of these people are too sick to. I mean, it's not just you're stuck at home. You can't actually go.
People should be able to comply with quarantine when you're sick from anything, but especially when you're sick from something that's at the root of what could become another pandemic or epidemic. And unfortunately, we don't have programs for people to be paid when they're sick, even though staying at home is in the public good. So these are all, I'm sorry, structural consequences of the way we've set up our society. We've incentivized people to cover up their monkeypox and go right back to work. There's a reason why I think the job that people have of people who die the most from COVID is line cook. That was like the most fatal job during the pandemic, because folks, they had very little job security. Those kitchens didn't close down. We were all ordering food service delivery, and someone had to cook the stuff, and they just kept going in with COVID. And there are public health implications for that, as well as obvious moral and ethical implications for the people involved. So I'd agree. Like, I do wish we had the kind of social supports, these other things outside of mandates that help to make this better.
I hear you, but we have a vast, well-funded, employing tons of people, gigantic disease control federal organization that has screwed up so badly and is in the process, as we speak, of screwing up in many of the same ways once again. And it's not a lack of, you can't say it's a lack of power or funding or what. I don't know what it is, but it's something fatal to the organization or to the nature of people who come to occupy vast federal bureaucracies, that they are just ineffective or like institutionally conservative or not adapting to new circumstances. We have to properly follow proper protocols, that kind of that hamstrings organizations from being effective, because it is horrifying to what they're doing. They're going to do it the same exact thing again.
I don't know what the issue is there. I think that people should do some investigation to see what's going on actually at the CDC, because it does feel like when we watched that recent interview with the public health official being asked, why is it that that the Biden administration isn't declaring a public emergency, because they were having a conversation about how these states didn't have to report unless there was a public emergency, a federal emergency declared. And the interview subject seemed to comprehend and understand that the thing that they were complaining about could be fixed if they would just make this declaration.
It's an emergency, now do the thing.
But there was this resistance that felt like it wasn't a dissonance because the person didn't want it to happen, but their hands were tied. They're waiting for the call from up on high. And we don't know what's going on with the Biden administration. We don't know what's going on with senior leadership and why they're not taking these steps.
Government websites are crashing as people are trying to, book vaccine appointments for the monkeypox vaccine. This is something that happens all the time with government websites. Not very much with non-government websites, but constantly for signing up for government websites.
Unfortunately, like for example, the famous example of the Obamacare website crashing, that has a lot to do with outsourcing to private contractors. I'm sorry, the government has forgone its ability to do basic things in a way that it used to 60, 70 years ago. Government has been shrunk. I'm sorry, very deliberately, these agencies have been shrunk by Republicans.
What agencies have been shrunk?
It's been a specific,
not a single agency has been shrunk.
Specific open policy since the 1970s in the Powell memo to make government ineffective so people can make arguments about the government was ineffective. When FDR, the most popular president in American history, was in charge, he went around and he hired people who were farmers, who were engineers, et cetera, to be leadership in the agriculture department and all of these other kind of agencies. There were people who knew what they were doing, and they were able to internalize in effect, without having to pass all this money off to private contractors, the things that need to be done in this country, and which have to be done at a federal level because we're building highways and bridges and public benefit and administering things like a public health response.
That's not what happened in the case of the testing with the CDC. Private organizations came up with great COVID tests. The CDC ruled them all legal, did its own, that didn't work. So it goes both ways, maybe. But
I mean, yeah, okay. There were also issues with the private tests. There were issues with distributions of tests. There were issues with the pharmaceutical companies keeping other cheaper international generics out of the market. There was a lot of things that were happening in the private sector as well that was a problem. The difference between the private sector and the public sector is when the public sector messes up, ostensibly we have democratic accountability tools. When the private sector messes up, they have corporate shields that prevent them from ever being liable, and they abscond. And that's what you're seeing with all of the liability shields that became a priority in the early days of COVID, and why probably no one's ever going to get any money from the way that their grandmother was killed in somebody's nursing home under Andrew Cuomo and the like.
The private sector is more accountable to the people than the public sector.
Strong disagree, but that's an ongoing conversation. My only point here is that there are a number of interventions that don't involve mandates that really aren't, I think, a bigger part of the conversation, because the people who don't want mandates aren't saying, I understand the critical issue here, let's come up with alternative solutions that can help keep our communities safe. It ends up being these conversations about just bashing each other over the head about how much you hate mandates. That's fine, but let's work together to come up with other ways to keep people safe instead of denying that there's an underlying problem here.
Well, one more issue here that I'm sure we're going to quarrel over. New York is calling on the WHO to rename the monkeypox virus due to the, quote, potentially stigmatizing effects that the messaging around the monkeypox virus can have on vulnerable communities. Meanwhile, the Director General of the WHO called on social media platforms to work with the agency to combat monkeypox disinformation.
The stigma and discrimination can be as dangerous as any virus and can fuel the outbreak. As we have seen with COVID-19, misinformation and disinformation can spread rapidly online. So we call on all social media platforms, tech companies, and news organizations to work with us to prevent and counter harmful information.
Of course, there are numerous examples of messaging from the government on COVID being wrong and, causing social media companies to adopt moderation policies related to the pandemic that are wrong. So that advice should be discarded. But I would not search for a new name for monkeypox now. It seems like that
ship has sailed. We
already know what it is, so we should just call it that. And also, it could be, if you say don't call it that something, what if people start calling it something more stigmatizing, given that it's mostly
I don't understand the stigma point. But there's two issues here. So it's the renaming the virus thing, which I think is silly, and I thought I heard people saying that like a month ago when this first started really emerging as a real issue, and it doesn't seem like that is for anybody. I don't know. That's one of these ideas that's going to be attributed to the left, and we're going to have a whole media cycle about it. But nobody wants this. So stop pretending like this is a real thing. It's not. Nobody wants it.
Listen
the second issue.
Listen.
The second issue is the misinformation point. And obviously, I have some reservations about social media's ability to monitor these things for the reasons that you point out. At the same time, my primary concern is that the desire to control or anticipate human behaviors is going to lead these organizations to be selective with the information they tell us in the way that we had in those early days of COVID, right? So there was this argument back then that we didn't want folks to rush out and buy certain kinds of medical protective gear because the doctors and nurses needed it the most, and staff in hospitals and things like that. So they soft pedaled the stuff about it being airborne. They told us they weren't clear about what masks were effective because they didn't want to rush in the bank. I get not wanting a rush in the bank. I wish they would just say, decline from buying this gear and isolate if you can because medical professionals need it, and buy up stores to deliver it to medical professionals instead of lying to people. And what I'm hearing about now with monkeypox, just an interview with a doctor from my podcast, is that there's some concern that if people talk too openly about the ways that monkeypox is transmitted and that the potential threat that it poses to people outside of the gay male community, that other people are going to rush to get the vaccine, when principally the folks who are affected are gay men and they should be getting the vaccine first and foremost. And we were having this conversation. I was like, okay, I totally get that. I don't personally want a vaccine, but I still would like to be fully informed about how transmission is required. Right. So to the extent that I can take steps. I mean, the WHO advice yesterday that says, don't share wet towels. I was like, you can share it.
Right.
You can pass it with wet towels. That's way less intimate than some of the modes of transportation that have been described up until this point.
If it's you had to have attended an orgy last week, then okay, no thanks. If it's towel sharing, I'm getting in that line for that monkeypox vaccine.
You go. Well, no, that is the opposite of my point. My point is that I need people to understand.
Okay, we'll wait for the next. But I
want to know so I don't share towels. You know what I mean? So I'm not at somebody's house and maybe I use Perel again and maybe I'm touching surfaces differently. I want to be able to make those decisions for myself without this presumption. Go ahead and limit my access to the vaccine. Go ahead and say, as they have done, that you have to have done X, Y, and Z thing.
Yeah, but I never agreed with that really when we were doing that for the COVID. Do you remember the excessive gatekeeping of today it's people between the ages of 62 and 71, and also if you have between 1 and 3 health conditions
so
and you were
when
born
you're getting off the Titanic, Robby's like, forget women and children, I'm getting in this boat.
Well, at that time though, it was not. It didn't seem like there was any point to it
it was older people first. Doesn't that make sense?
Well, older people first made sense, but there was some racial coding of it too. There was some that didn't make sense to me. There was then there was essential workers. Well, who's not an essential worker at this point? That definition included virtually everyone. Not me. I see what you. Rising is essential for various. No, I'm kidding about that. But if you stretch their definition to what counted as an essential worker, at some point it was basically the entire workforce.
I would quibble with how those lists get designed, just like I would quibble with some of the hoops that are being required of the monkeypox vaccine. But broadly speaking, I think it's
the BMI stuff.
Clear.
You're gonna weigh yourself, and if you're that was done for
I think most people who know that they're obese know it from having gone through the
BMI
last.
is not even a good indicator.
No, it's not a good indicator, but it's
at
a certain point you have what you have. But I do think that some of the things were too imprecise and not particularly accurate, and I think that the same thing is happening with monkeypox. But the general principle that there are some people who obviously have a greater need when there's scarcity is a good one. I just wish that we lived in a country where people had a kind of patriotism or sense of community of yesteryear where they would self-censor and wait in line so that the more vulnerable members of our community could be safe. I wish that the government would have more confidence in Americans to go ahead and do the right thing. And I also wish Americans would actually raise to that challenge, because unfortunately we have seen some behaviors in the context of COVID that give me some skepticism that people will do the right thing if given the freedom to self-select.
Rather than relying on people to do the right thing, I would like if the FDA and the CDC would get their together and get more of these vaccines. We need more. We don't have enough vaccines right now even if we're just keeping it.
This was Joe Biden not ordering the vaccines, knowing that this was coming down the pipe.
Right. We clearly need more vaccines for the vulnerable community, the gay and bisexual male community. And we need to understand a little bit more. It needs to be better communicated exactly how often this will spread outside sexual transmission, which is not clear to me based on the conversations we've had with people over the last 3 weeks, from almost never to
wet towels.
It kind of can. Right. That's a big difference.
It's a lot of wet towels out here.
That's a big difference. So that needs to be understood, and we need more. We need obviously more of these vaccines.
Yeah.
So we don't need to change the name. That is not priority. Not on the list of priorities for things to do. More Rising right after this.